it's Dr. Gail. In this video, I'm going to talk to you about smear tests. A smear test is a simple procedure in which we remove some cells from the cervix or the neck of the womb. It can also be called a pap smear or cervical screening test. The sample taken from the neck of the womb is then processed and examined for the HPV virus or human papillomavirus. This virus is important because it is the prerequisite to the formation of cervical cancer. So some people think smear tests are aimed at diagnosing cervical cancer or cancer of the neck of the womb, but this is not the case. A smear test is a screening test to look for abnormalities that could go on to progress to become cancer, so that these are treated even before cancer is formed. So how do we take a smear test? So we take a smear test by inserting a speculum, which is this instrument, into the vagina. It is then opened up to visualize the cervix. We then take this broom, and as you can see, the bristles are soft, so it's not painful. The broom goes through and is gently moved over the surface of the neck of the womb to dislodge the cells. The cells are then put into this vial of solution. It is agitated to get all the cells off, and then this is transported to the lab where they look for the human papillomavirus. And they may then go on to actually look at the cells that we've removed under the microscope. A smear test is usually quite a straightforward and short procedure, but unfortunately, although smear test is such an important investigation and is usually fairly simple, many women, up to 1/3 of women, don't go along to have their smear test performed. I've also done a video about some tips and tricks that you can use to make your smear test less uncomfortable or less painful, so please view that after this video. So, what happens to the sample after we do the smear test? The sample is taken to the lab and they look for the HPV or human papillomavirus. If the sample does not contain the virus, then we know that there is almost no risk of that woman getting cervical cancer, so no further investigations are done. In this instance, the woman is invited for another smear test, that is routine recall, in either 3 or 5 years, depending on the age of the woman. In the UK, we start doing smear tests at age 25 and we complete the smear program at age 64. The frequency of smears changes at age 50. So between 25 and 50, women are invited to have smear tests every 3 years, and between 50 and 64, every 5 years. So if the HPV is negative from the smear, then that's it, end of story. You get your next smear test in either 3 or 5 years, depending on how old you are. If the sample does show HPV, then they look at the cells that we've removed. So note, you're not required to go in for another test, another smear test. The smear test is examined both for HPV and, if necessary, those cells that were taken at the same time are looked at under the microscope to look for abnormalities. If abnormalities are seen in the cells, then the patient is then referred for a colposcopy examination, which I'll discuss later. If the cells look normal, then the patient is reassured and does not require colposcopy. She just requires to have another smear test in 1 year's time instead of the 3 or 5, as is usual. So, if the smear is positive for HPV and the cells look normal, then the woman has another smear in 1 year. If that second smear in 1 year also shows HPV. Again, the cells are looked at. If the cells look normal, she is again invited to have another smear test in 1 year's time. If that third smear test shows HPV, then she's referred for colposcopy. So basically, women have 3 opportunities to clear the HPV virus. And sometimes they do clear the HPV virus and the HPV becomes negative, in which case they go back to normal recall. If at any point the cells look abnormal, and the cells are always looked at if the HPV virus is positive, if at any point the cells look abnormal, then the patient is referred for a colposcopy. So what is a colposcopy? A colposcopy examination is a test in which a colposcope, which is this instrument, is used to look at the cervix under different lighting and using different liquids upon the cervix, such as acetic acid and iodine. Now, it's important to note that although all gynecologists will perform smear tests, and many practice nurses, GPs, specialist nurses will perform smear tests, not all gynecologists or even specialist nurses perform colposcopies. So if you've had an abnormal smear test with abnormal cells and been referred for a colposcopy, please ensure that the person that you are going to see is an accredited colposcopist. Likewise, if you choose your clinician to perform a colposcopy after you've had an abnormal smear test, again, just do your background checks and just make sure that the person is accredited for colposcopy so that it saves an unnecessary journey if you go to see the wrong specialist. So for example, I'm a gynecologist, however, I don't do colposcopy. So if one of my patients has an abnormal smear test, I will then refer to a colleague who performs colposcopy. A colposcopy examination, I won't go into detail because as I've said, I don't do colposcopies, but basically this instrument is used and the practitioner looks through the eyepieces and the cervix is visualized through a speculum. They put solution on the cervix because the solution shows up abnormal areas, and they may do a biopsy, which again goes to the lab, which gives more information and a tissue diagnosis. So that's it. That's basically covers everything about smear tests. So if you're due a smear test, please go along and have one. It is one of the few methods we have to accurately predict patients who may go on to have a cancer and therefore offer effective treatment before this happens. If you'd like to share any experiences you've had in having smear tests, please do so in the comments. If you've found this video useful, please like and subscribe, and please look out for my video which tells you some tips and tricks that you can use to make smear tests less uncomfortable or less painful. And hopefully that will encourage more women to come along and have this essential investigation in gynecology. Thanks for watching. See you next time.